Mind Blitz, the smart path to nursing excellence. Mind Blitz is an interactive segment designed to help nursing students prepare for their exams. In each episode, a series of nursing-related questions are presented, and viewers are encouraged to test their knowledge by answering them. It's a fast-paced, engaging way for students to reinforce what they've learned and challenge themselves in real time as they get ready for their exams. A client is admitted to an acute care facility with complications of celiac disease. Which question would be helpful initially in obtaining information for the nursing care plan? A. What is your understanding of celiac disease? B. What foods do you typically avoid? C. What symptoms have you been experiencing? Or D. What medication are you currently taking? The correct answer is A. This is because assessing the client's understanding of celiac disease is crucial for developing an effective nursing care plan. This question allows the nurse to gauge the client's knowledge of the condition, identify any misconceptions, and tailor education and interventions accordingly. A client presents to the urgent care center with complaints of abdominal pain. Suddenly, the client vomits bright blood. What is the nurse's most immediate action? A. Takes the client's vital signs. B. Initiates vomiting precautions. C. Assesses the client's level of consciousness. Or D. Calls the healthcare provider. The correct answer is D. This is because vomiting red blood, also known as hematemesis, is a serious medical emergency that requires immediate medical attention. The nurse's most immediate action should be to call the healthcare provider to inform them of the situation and request further instructions. A nurse is preparing to administer an enteral feeding through a nasogastric tube. The nurse would place the client in which position during and after the feedings? A. Fowleries, B. Supine, C. Side-lying, or D. Prone. The correct answer is A. Placing the client in Fowleries position, which is elevated at 30 to 45 degrees, is the recommended position for administering enteral feedings through a nasogastric tube. This position helps to prevent aspiration, which is the accidental inhalation of feeding or stomach contents into the lungs. When the client is in Fowleries position, gravity helps to keep the feeding in the stomach and away from the airway. A nurse is caring for a client in the emergency department who has right lower quadrant abdominal pain. After noting a white blood cell count of 16,500/3, the nurse should question a prescription for which of the following? A. Milk of magnesia, B. Dicyclamine, C. Tylenol, or D. Sulfamethoxazole trimethoprim. The correct answer is A. This is because milk of magnesia is a hyperosmotic laxative, which means that it draws water into the intestines. This can worsen appendicitis, which is an inflammation of the appendix. The appendix is a small finger-shaped organ attached to the large intestine. Appendicitis is a common cause of right lower quadrant abdominal pain. Eager to learn more? Don't worry, we've got plenty of questions lined up just for you. At HCT, we know that preparing for the NCLEX isn't just about answering questions. It's about building confidence, sharpening critical thinking skills, and developing the mindset of a future licensed nurse. That's why we're here to guide you every step of the way, ensuring that you don't just memorize concepts, but truly understand them. Every question you answer is a stepping stone toward your success. Every challenge you face is an opportunity to grow. And every moment you dedicate to learning brings you closer to achieving your dream. It's not always easy, but remember, nothing worth having comes without hard work and dedication. So stay committed, keep pushing forward, and trust the process. Your NCLEX journey is our journey too, and we won't stop until you're ready to pass with flying colors. Keep practicing, stay motivated, and let's conquer the NCLEX together. After the deflation of the balloon of a client's Sengstaken Blakemore tube, the nurse monitors the client closely for which esophageal complication? A. Hemorrhage. B. Perforation. C. Stricture, or D. Fistula. The correct answer is A. Esophageal hemorrhage is the most common complication of Sengstaken Blakemore tube deflation. This is because the sudden decompression of the balloon can cause the esophageal wall to tear. The nurse should monitor the client closely for signs of hemorrhage, which may include hematemesis, vomiting of blood, melena, black, tarry stools, hematochezia, bright red stools, hypotension, low blood pressure, tachycardia, fast heart rate. A nurse is participating in a health screening clinic and is preparing teaching materials about colorectal cancer. Which risk factor for colorectal cancer would the nurse plan to include in the material? A. Personal history of ulcerative colitis or gastrointestinal GI polyps. B. Exposure to asbestos. C. Frequent use of NSAIDs, non-steroidal anti-inflammatory drugs. Or D. Excessive alcohol consumption. The correct answer is A. This is because ulcerative colitis and GI polyps are both risk factors for colorectal cancer. Ulcerative colitis is an inflammatory bowel disease that can cause chronic inflammation of the colon and rectum. Over time, this inflammation can increase the risk of developing colorectal cancer. GI polyps are small growths that can form in the colon and rectum. Some types of GI polyps, such as adenomas, are more likely to become cancerous over time. A nurse has taught a client about an upcoming endoscopic retrograde cholangiopancreatography procedure, or RCP. The nurse determines that the client needs additional information if the client makes which statement? A. I'm glad I don't have to lie still for this procedure. B. I'll need to have someone drive me home after the procedure. C. I might feel some discomfort during the procedure. Or D. I'll need to fast for 8 hours before the procedure. The correct answer is A. The client is incorrect in stating that they do not need to lie still for the ERCP procedure. The client will need to lie still on their side or stomach for the entire procedure, which can take up to 2 hours. Lying still is important to allow the endoscopist to accurately visualize the bile and pancreatic ducts and to perform any necessary interventions. A client has undergone subtotal gastrectomy and the nurse is preparing the client for discharge. Which items should be included when teaching the client about ongoing self-management? A. Consuming a bland diet. B. Taking antacids as needed. C. Eating smaller, more frequent meals. Or D. Avoiding all fatty foods. The correct answer is C. This is because following a subtotal gastrectomy, the stomach is smaller and empties more quickly, which can lead to dumping syndrome. Dumping syndrome is a group of symptoms that can occur after eating a large meal or a meal that is high in sugar or fat. Symptoms of dumping syndrome can include nausea, vomiting, diarrhea, abdominal cramps, and dizziness. Curious for more? If you're ready to dive deeper and explore HCT, you're in the right place. Be one of us. At HCT, we make it happen, creating a joyful environment, delivering compassionate care, and always striving for growth. Join us and be part of something extraordinary. Don't forget to like, share, subscribe, and hit that notification bell to stay updated.